Hello, listeners. A warm welcome to Views on Health. A great pleasure to have with me on the program Dr. Nilangika Sandakumari, consultant physician and head of the Department of Pharmacology, Faculty of Medical Sciences, University of Sri Jayawardhanapura. The topic under discussion on the program today is autoimmune disease. Over to you, Doctor, to introduce this very interesting topic.
Yes, thank you very much for that warm welcome. Today, I thought of discussing about a common but less spoken disease, autoimmune diseases. So, as you all know, immune system in our body fights against infections. Now, viruses, bacteria, when they enter into our body, our immune system must be prepared to fight against those. In certain diseases, our body and immune system mistakenly attacks our own cells. Then we call them autoimmune diseases. Auto means own, our immune diseases. So, immune system is mistakenly attacking our own body. So, some of these now, you have quite a lot of autoimmune diseases. More than 80 autoimmune diseases are there. Some of these will attack only one organ. If I give you an example, now diabetes, which is a very common disease, you know that there are two types. One is type 1 and the other one is type 2 diabetes. Type 2 is the much commoner one, but type 1, which tends to occur in relatively younger age groups and small children, is an example for autoimmune diseases. So, in type 1 diabetes, this will affect only one organ in the body, that is the pancreas, which synthesizes insulin. So, what happens there is our body generates something called autoantibodies to attack against the pancreas, and once the pancreatic cells which secrete insulin are destroyed, the patient will develop diabetes, that is type 1 diabetes, where you will need lifelong insulin treatment. But some autoimmune diseases are different to this. They will attack multiple organs in the body. The whole body is affected, your kidneys, blood, then the brain, joints, skin. A common example for this is SLE. Some of you may have heard of and some may not. But this again is a quite common autoimmune disease. SLE stands for systemic lupus erythematosus. So in systemic lupus erythematosus, it's not only one organ that is affected by this abnormal immune system. Your kidneys can get affected. So, when the autoantibodies go and attack the kidneys, the patient may experience blood in her urine or frothy urine where protein leakage is there. And when it affects the skin, there will be skin rashes. Now, in SLE, you get a typical skin rash in your face in a butterfly sort of a distribution involving your cheeks. And then it will also affect the joints, causing an arthritis type of a disease. Can affect the gut. You can get mouth ulcers. There will be hair loss. So all the body system, most of the organs are affected. So such autoimmune diseases are also there. So it's a spectrum. You get lot of diseases and it varies. So who are the people who can get this disease? It most commonly affects the women of childbearing age. That is the commonest age group, but males also can get these sort of diseases, but rare. Commonest affected group is the age group between 20 to 50 age group. Childbearing age group females are mostly affected. Now, when we get patients with this sort of diseases, now it's most of the time, that is the first time that they get to know that they are having some autoimmune disease like SLE. And then they question us, why did I get this, doctor? Is it from my family, but none of my family members are having? Is it due to genetics, or is it due to food that I eat? Now, the simple answer for that is still we do not know the exact cause for autoimmune diseases. Still, there are a lot of hypotheses. It may be due to genetics. There can be genetic predisposition, but environmental factors such as certain viruses, infections, diet, and certain chemicals also predispose to autoimmune diseases. So, now I told you there are a lot of autoimmune diseases. Type 1 diabetes was one example. We discussed about it at the beginning. But you may have heard about rheumatoid arthritis. That is not a rare one. So most of you have heard of. Patients present with small joint pain, especially in the hands. So that is another autoimmune disease affecting mainly the joints. Not only limited to joints, it can affect other parts of the body, but mainly joints are involved. And then you have some other autoimmune diseases involving your nervous system. One such disease is multiple sclerosis. There, what happens is this immune system produces antibodies which will go and attack your nerve cells. It will damage the nerve cells. So the patient will come to us complaining of numbness or weakness of a limb, abnormality, abnormal gait, walking abnormalities, balance problems. So you need to have a higher degree of suspicion to think whether this could be due to an autoimmune disease, because similar presentations can occur with a lot of other medical conditions. So unless you suspect the possibility of an autoimmune disease, you will miss that. So nervous system specific autoimmune diseases are also there, like multiple sclerosis. And some of these will affect your digestive system. We have inflammatory bowel diseases. Now, in inflammatory bowel disease, patients are young patients coming to you with bloody diarrhea, weight loss, and features of malabsorption. They are thin, anemic with lack of blood. Their bones are weak because their gut is not absorbing adequate nutrients. Gut is affected by this immune problem. So, lot of such diseases are there. No organ system is spared. SLE, arthritis, then bowels, neurons, and then your hormone producing glands, for example your thyroid. Thyroid can get affected, causing excessive secretion of thyroid hormones and resulting in abnormalities. Certain other organ systems like adrenal glands can also get affected. So there are quite a lot of autoimmune diseases. It's fairly a common condition.
Thank you so much, Doctor, for that very detailed and lucid explanation, introduction, in fact, to autoimmune diseases. Now, you highlighted a number of areas in the body that can be affected. Now, will there be a situation where some patients can have more than one of these problems? Like the pancreas can be affected because of diabetes, it can be the digestive system, it can be the nerves. So can there be certain patients having more than one cause that leads to autoimmune diseases in their system?
Yes. So when one autoimmune disease occurs, for example, patients with type 1 diabetes, they have a higher chance of getting another autoimmune disease in them. For example, autoimmune thyroid diseases are much commoner in patients with autoimmune diabetes. And now certain rheumatological conditions such as SLE, they have autoimmune damage, they have autoimmune problem, basically it's SLE, but it can be associated with other autoimmune rheumatological problems. There are rare entities. I'm not going to mention their details here, but just for your information, there are certain conditions like systemic sclerosis, mixed connective tissue disorders. They are also rare autoimmune diseases which can be associated with SLE. So patients who are having autoimmune diseases of one type may have a higher tendency to get autoimmune diseases of other organs as well, because the whole immune system is malfunctioning. So, and diagnosing this sort of disease is also a bit challenging sometimes, because patients don't come with specific symptoms. Some symptoms are very vague. You can get these sort of symptoms in multiple other conditions. For example, most of the time, 90% of them complain of fatigue. So fatigue is not specific to a single entity of diseases. It can be due to a infection, or it can be due to diabetes, or lot of other causes are there which can result in fatigue, easy fatigability. Anemia may also cause it. So you can't, that's a very non-specific but very common feature of autoimmune diseases. They complain of easy fatigability, muscle pains, aches, swelling, redness of joints, and sometimes complain of low-grade fevers. And if the nervous system is affected, complaints of numbness of feet and hands, hair loss, skin rashes, those are the common symptoms. But they can occur in multiple other diseases. So the clinician, doctor, should have a higher degree of suspicion, especially if your patient is in the childbearing age group.
Doctor, that is what is cause for alarm, the way I see it, that childbearing age group, because you said they're relatively the younger generation of females, and then the question is they have a long way to go. How does this affect them, and how would it affect a fetus when they become pregnant?
Yes. So this is the exact question that more than 90% of patients diagnosed with this condition will raise at their first visit. So there, I must say, to tell you frankly, there's no cure for this sort of diseases, like a viral infection or like a bacterial infection where you can treat with antibiotics or antivirals or whatever, which will resolve with time and get cured. Autoimmune diseases, there's no such cure. But it can be controlled. The symptoms can be controlled. What we see is flare-up of disease where symptoms, there will be a period where symptoms are more prominent, and then with or without treatment, it may go to a remission where the symptoms will go away. So we call these sort of diseases, they have a relapsing and remitting course. It will relapse at a time, and the patients may experience joint pain, the skin rash, protein leaking in urine, and then blood cells breaking down, and that relapse will respond to treatment, and then it will go into remission, and in another few months or few years it may again relapse. Now we can't exactly predict when will it relapse. That will vary from person to person. Some people will get only one flare and then it will settle down. Meanwhile, the others can get flares very frequently. So then the prognosis and the survival and the outcome of the disease is not very good. But if it settles down with a single flare, then the prognosis is good. And your next question was, what is the effect of this disease to the fetus? Again, we need, like SLE or any other rheumatological disease or autoimmune disease can affect the fetus. There you have to take a decision balancing the benefits of treating the baby with drugs with the risks of allowing the disease to progress. Now, most of the time during pregnancy, now pregnancy is a condition where the immune system is a little weakened. So pregnancy is a natural condition where the immune system is weaker than normal. So because of this weak immune system, during pregnancy, SLE tends to go into a remission. But if its effects are seen during pregnancy, for example, if the kidneys are affected due to SLE, then you need to treat, otherwise it may harm the baby. So treating autoimmune diseases is also, treating them with drugs is also a problem. These drugs are highly toxic drugs. They can affect the baby. So you need to take a decision which drug to take. It will cause some damage, but if the benefits are more when compared to the damage, we will start these patients on such drugs to minimize the damage. So it's a crucial decision, must be made by a specialist in that field, and patients must be advised to strictly adhere to their plan of management given by their physician or the endocrinologist or the managing consultant. Otherwise, it can adversely affect both the mother and the fetus. And outcomes, like adverse outcomes, can be minimized by cautious supervision.
How common is this problem?
We can't say that it's very rare, because you have lot of diseases. It's fairly a common condition. SLE itself is not very common, but when you take the whole spectrum of diseases, arthritis, bowel disease, then multiple sclerosis, SLE, all the autoimmune diseases, if you consider all of them, it has affected significant proportion of patients throughout the world. So although we don't know the exact etiology or the causative factor for these, now it has affected quite a large number of people. So as I told you at the beginning of this discussion, the clinical diagnosis is a bit vague, because this can mimic a lot of other illnesses. So you have to arrange some laboratory investigations. Usually we do a test called ANA. ANA stands for anti-nuclear antibodies. So if you suspect SLE or any other rheumatological autoimmune disease, we will ask our patient to get a ANA test done, anti-nuclear antibody test done. So this becomes positive in the presence of some autoimmune conditions, but it is not specific for SLE. Can become positive in lot of rheumatological conditions, but once it is positive, it will direct you towards more specific investigations. Now suppose we get a patient with a rash in the face and joint pains and leaking protein with urine and muscle aches with easy fatigability. And when we arrange ANA in that patient, if it becomes strongly positive, then you have strong suspicion that this could be SLE, and you go ahead with renal biopsy, kidney biopsy, biopsy from the skin lesions to confirm your clinical suspicion. Then you can you can inform your patient about the diagnosis and its natural cause and the treatment plan that you're going to give.
Doctor, not a very pleasant question to ask, but in the case of a woman who is pregnant, would you say that she wants to become pregnant, and obviously you assessed the patient and that she has these conditions, would it be advisable to tell her it's best that you don't become pregnant? Because you did say that treatment can be given, and it is given based on the condition. It is also given if it outweighs the negatives. It could be more positive in the case of the patient and protecting her and the fetus. But I'm talking about the worst case scenario.
Yes. Now, when talking about pregnancy actually, the disease has to be very well controlled for the woman to go ahead with pregnancy. Now, we have certain treatments. We will discuss it in a later session, because I don't think today we have enough time to discuss about treating autoimmune diseases. But in treatment regimes, we have multiple drugs, and we can treat this lady who wants to become pregnant and is having SLE until it goes into a remission. So when the disease is fairly very well under control and patient is in remission, you can allow her to become pregnant. Certain drugs like steroids, and we have specific drugs which can be given in pregnancy with minimal effect to the fetus, such as azathioprine namely. Such drugs can be given throughout the pregnancy with minimal effect to the baby. So SLE actually, the disease itself also go into a remission during pregnancy. So SLE is not a contraindication for a pregnancy. They can become pregnant, but it has to be, the pregnancy throughout has to be monitored very carefully by specialists in that field.
Just a question, doctor, time is catching up with us. How cooperative are the patients once they are diagnosed and they know this is the way to go in terms of treatment?
Yes. Now, I think the patient's compliance and successful outcome depends on the clinician and patient both. The doctor, once the diagnosis is made, should take some time to explain it in detail and explain the natural cause of the disease. We must not lie the patient. We must say that there's no cure, but the symptoms can be successfully managed with the available medications, and we must give hope to the patient. Must not lie, but must not give hope. We must give hope to the patient, and we have available wide variety of medications to treat this. And then when you explain it in detail, patients will also be compliant with us, and they can lead a near normal life even with the autoimmune disease.
One final question. In your practice and as a medical professional, would you be able to tell us if anybody outside this age group can be affected? I'm talking about the women who are mostly affected. And also the other question is, would men also be affected by it, maybe to a lesser degree or lesser number?
Yes, of course. The childbearing age group females are the most commonly affected age group. But the other groups can also get affected. And men are also there with SLE, rheumatoid arthritis, inflammatory bowel disease, even type 1 diabetes, very common in men also. So, although the autoimmune diseases frequently affect childbearing women, no other age group or males are exempted from it. They are also affected.
Thank you, Doctor. And there we end this very interesting discussion on autoimmune diseases. And we are grateful to you, Dr. Nilangika Sandakumari, consultant physician and head of the Department of Pharmacology, Faculty of Medical Sciences, University of Sri Jayawardhanapura, for being with us on the program and sharing your expert knowledge with our listeners on this subject. Thank you so much, Doctor. My thanks also go to Malinta Deshapriya for technical assistance. I'm Fatima Razikada saying good night and hoping to be with you next Monday, same time on Views on Health.